To optimally care for our community and do all the things that we need to do as a healthcare system, we actually need all of our staff. We firmly believe that. And I've stated for years, in many forums, that there's really only one job here at Gundersen Health System, and that's caring for patients. And with every job and every person here is essential to delivering on that promise of care. I believe that as deep as you can possibly believe it. I finish with our path to success continues to be unity. We have to stay together and we have to support each other going forward and work strong together in order to get to the end. If we keep that unity of our purpose and our support for each other, we will get to the end of this, and we'll certainly be tired, but we will succeed. If we start to divide ourselves, that leads to a dark place, and it doesn't get us where we need to be together to survive. So please, when you're thinking about Gundersen and our work and our emergency, think about we, think about us, and try to resist the urge to think about me and they and the divisive words that we can have. That's normal human behavior when we're all stressed out. I understand that, but try to resist that and pull back to, we will get through this. We will get through this when we do it together and we support each other through the difficulty. And that is the way forward. So I am optimistic of where we will eventually go, but I do understand it will be some tough times coming up. But we will get to the end of this, and we will emerge, and we will be stronger and better able to serve our communities because we went through this together. So please stick in there with us, and we're here to support you. And I am very grateful for the work that you're doing despite all of that fatigue.
The first is in regards to questions that express concerns with staffing shortages should people leave.
So I'll take that one. So the first thing I would say, of course, we are concerned about current staffing shortages and any potential future shortages. We've felt these shortages from before the decision to require vaccination, of course, and it is possible that some will choose to leave over the vaccination requirement. This would certainly be unfortunate and not what we would hope to happen. But we can't avoid this possibility. Our mission to optimize safe care compels this decision. As I've mentioned before, we can't compromise that purpose. And in addition, we will not be able to avoid the path, this path because of the government mandate that is coming down as well. So no one in healthcare will be able to resist this path. But if we see further staffing shortages as a result going into the future, we will decrease services to preserve our remaining staff until we can recruit additional help. And we will recruit more, but we understand that we don't want to further burn out the staff that remain. And we will adjust our services in order to do that if that future should occur.
Next, the GHS website has a notice of non-discrimination that conflicts with information in the December 17th DEI presentation. Will our website be updated to acknowledge the health disparities of our minority patients? What liability do we have for the acknowledged disparities in outcomes for our minority patients?
Great, a question that's not about the vaccine and the virus, so that's awesome. And I got to tell you, I'm very pumped up about people thinking about the disparities and the equity issues that we've been talking about. So good for you thinking about those issues that are going to go forward. I've read our statement, and you know what? I don't see that there's a conflict there. So I disagree that there's a conflict and the statement needs to be changed. In fact, I would stand even stronger around that statement of non-discrimination. It is our intent and has always been our aspiration to treat everyone the best we possibly can, regardless of who they are, or where they come from, or what they look like. And we will continue to do that. I think our statement states that actually beautifully. And so all this does is make us double down. The fact that we are going to continuously work to improve the health of all and closing any care gaps just reinforces that commitment. So I think it just says we really believe in that commitment. It's a beautiful commitment, and it's one that we intend to continue to drive toward and accelerate the accomplishment of that. So, so good question, but I think it aligns perfectly well with what we're trying to do, and the statement needs no revision.
The next question. Last year, we were told many times that our PPE protocols are enough to stop the spread of COVID at work. Gundersen told the media that we had no known cases of hospital COVID transmission because of the effectiveness of our protocols. On September 7th, leadership said that if a patient asks to have only fully vaccinated staff, we are to tell them that our PPE protocols are enough to keep everyone safe regardless of their vaccination status. Now, those filing for mandate exemptions are being told they are a grave danger to their patients, co-workers, and community, and that they are a burden to Gundersen. How does our senior leadership reconcile these very different messages?
So I'll take that one too. Again, thanks for the question. I would point out that this is an example of the issue that I just addressed regarding statements being made that seem factual when they currently aren't. I would go back to what Dr. Kowalski said about the changing environment, and what worked in the past does not necessarily mean that it will work in the future. We have communicated many times that the infectivity of the Delta variant made it impractical to rely solely on our prior success on maintaining a safe environment of care. We certainly still believe in PPE and the protocols as part of that safe care environment, those Swiss cheese pictures that Dr. Kowalski showed. We certainly believe in that. The vaccine is a clear addition to that safety, although admittedly, it's not perfect. It's the combination of things that matter. What we've told patients is that we are committed to providing the safest environment that we can practically design. It's simply untrue that any person has been labeled a grave danger. I have read the communications. There was a communication that used those words, but OSHA, a federal agency, declared that the COVID Delta variant was a grave danger. The COVID Delta variant, not a person. And we did repeat that declaration in communication to our staff. But no staff member was called a grave danger, as this question would imply. Also, no staff member has been called a burden. It is a fact that administering testing and the logistics around that administration, resulting and verifying those tests for exempted staff does cause an added burden to this organization. That is a fact. We are going through with plans to accommodate exempted staff through these processes. We will have to monitor whether this burden is unsustainable or an undue burden, as it's mentioned in regulation language. The statements in this question regarding people being called a grave danger or people being a burden are simply untrue and misleading, and I can't let those comments go by without comment.